After you get one of your balls removed from your testicle,
Scrotum.
your scrotum, thank you. Do you feel lopsided? Is there a weight differential?
Immediately, yeah, there's some lopsidedness.
Walk with a little bit of a swagger. They get a little bit of like a
You got a
right
little
side,
bit of a limp, right?
right-sided swagger that makes you look like you're just like a cool
But
guy.
then I think over time, things just tighten up,
Yeah, right.
and then you're good back in business.
Let's start off with this before we get into how this all kind of came to be. I will start with this one question that we didn't get to ask you the first time we recorded with you. After you get one of your balls removed from your testicle sac,
Scrotum.
your scrotum, thank you.
Oh.
Do you feel lopsided? Does it feel like, is there a weight differential? How does that feel once it's all healed, obviously?
Immediately, yeah, there's some lopsidedness.
Walk with a little bit
And
of a swagger.
I don't mean
They get a little bit of
look.
like a
You got a little bit of a limp, right?
right-sided swagger that makes you look like you're just like a cool
But
guy.
then I think over time, things just tighten up,
Yeah, right.
and then you're good. back
Yeah.
in business.
I also didn't.
That
get
was
to
the
ask
opening
this.
hook question. I hope that question is the one that people listen to and they go, God, I got to keep listening for more of this.
I also have a question that I didn't get to ask. So, for context, we recorded an episode with you a few weeks ago at an event. I don't know if I should say which event publicly, but
No, you absolutely should.
That's fine.
so
Yeah.
it was
Wearing the friggin' shirt.
Yeah. The guy came in an outfit.
it was an event for the Canadian Cancer Society, and unfortunately, we lost the recording. So
Yeah.
we're back here recording again. And there was a question that I really wanted to ask, but we were in front of a room full of professionals, let's say. And I was curious, when you had your testicle removed, is there any consultation on like the, on the aesthetic side where they're like, hey, look, you've got a lot of extra skin in your testicles, or your balls hang too low. And you're like,
is there a plastic surgeon sort of setup? They're like, well, we're down there anyway. Like what? Like
should we tighten them up or
like
like
a facelift? No,
Yeah.
no, I didn't get any of that consult.
Honest to
Like,
God,
I was-
if you removed one of my balls right now, I don't
That was
think
the
you'd
least
be
of
able
my
to tell.
worries.
Yeah.
Yeah.
Honestly, it was least of my worries.
Yeah.
I just wanted to kind of be cancer free, maybe.
Because spoiler alert, this was
So-
not an aesthetic surgery.
no, purely medical.
Purely medical.
I don't know.
This wasn't some weird, like, I'm going to go to Turkey and just get my
Yeah.
nut removed just
removed.
because.
Just because it's on the menu in Turkey.
Yeah. It's the reverse hair transplant in Turkey. You're like, I have too much testosterone coursing through my body. I want less hair. Let's remove a ball. and see
Okay,
if
well,
that
this is
helps.
getting ahead of ourselves now, but now you've opened up a door that I'm actually curious about.
God, what a beautiful
is-
disaster this is turning
is-
out to be. I love this.
Okay, so like Cole's notes. Okay, by Cole's notes, I mean like I'm just gonna say this now, and then we can revisit and go into detail after. But you had testicular cancer.
Yeah.
You had your nut removed, one nut removed, testicle. I'll say testicle removed. What is testosterone production? Is there a change in testosterone production after you have a testicle
Initially,
removed?
Yeah, there was a dip, but then your other testicle just kicks up into overdrive. And
Oh,
now
cool.
you're back in business, back in like your normal parameters.
Sweet. So your
I-
balls are like your kidneys.
Pretty much.
They'll pick up the slack. If one of them goes.
that's a fair comparison.
Got told, but the pee stored in the balls, right? Like it's what everyone thinks.
He is stored in the balls.
until you go to school and realize, like, wait a second. But yeah, like I mean, there's a drop and then it all kicks back up, and now like even my numbers. I looked at the trend over the last like 9 years. It's actually been getting lower and lower, and I was panicking. Like, oh shit, what's going on? But it turns out when you do your your testosterone blood check in the morning, it's higher.
Oh
As
yes.
opposed to later in the afternoon.
Yeah.
It's dipped down. A little.
Yeah. My wife has a thyroid condition, and she can only get her thyroid checked in the morning. If they check it any other time of day, they
It's
just like toss it out. They're
Yeah.
just like it's just not a good result.
Yeah.
So you have to check it in the morning.
Yeah.
Okay, so I'll set the stage here. Brian mentioned it. We were asked to come in and do a little live recording for the Canadian Cancer Society. We're in Ottawa. It was a beautiful, beautiful time. So
It snowed 20 centimeters the next day.
wild, yeah. And what a great day for me and Brian to go to the spa. It was a great time, and Taaha, we had you come up there in front of all of your peers and colleagues, and you so openly and vulnerably shared your experience of going through cancer. It was very fun. We had lots of laughs. Unfortunately, the recording we had a bit of a technical snafu. We lost the recording, and you just so happened to be like, well, hey, like that sucks, but guys, I'm going to be on a road trip coming out.
Yeah.
Towards where you guys live, and I would love to pop by the studio. So welcome to the studio. Thank you so much for popping in on your beautiful cross country road trip.
Thank you guys for having me. I mean, it's been great.
give our listeners a little bit of an introduction.
Yeah.
Who are you? What do you do? And what is your involvement with the Canadian Cancer Society?
Yeah. So my name's Taaha. I was diagnosed with testicular cancer when I was 17. Some metastatic testicular cancer up to the lungs and the back of my abdomen. So post-diagnosis, I really wanted to be a nurse. Obviously, through my experience in the hospital, I realized how rewarding of a career that is. So I work professionally as a registered nurse in Toronto, and on the side, I like to support those who are going through cancer, not just like medically, but also through advocacy. So some broader changes to our healthcare systems, hopefully some broader changes to public awareness and the plans and what we want to do to make, find a cure for cancer. I feel like that gets thrown around a little too much, but hopefully find something to make it the lives of those diagnosed with cancer easier.
Can you say more about that? That's really interesting. Like I think I understand what you mean about the idea of quote unquote finding a cure being thrown around quite a bit.
Yeah.
But like in your words, what does that mean?
Like growing up, I used to think cancer was one disease, right? It's just one disease, this massive tumor on the side of somebody's neck or in their lung, and that's it. But then you grow up and you realize, like, wait a second, there's hundreds of different types of cancers. And even in my own like diagnosis, I was 17 at the time, and I remember seeing like kids with tubes on their nose, and I was like, when am I supposed to get my tube down my nose? But turned out I didn't really need it. And you come to realize that there's cancers like everywhere in the body. You can have some cancers in your brain, some tumors in your brain, tumors in your lungs. You can have non-tumor cancers, so types of blood cancers. Get some cancers in your like muscular cancers as well, right? So it literally anywhere in your body, there's some sort of excessive cellular growth that can cause a cancer that really hijacks the way your body works.
It is like a weird. I think that we've touched on this at least once before in the show, that it is like a very strange thing that we understand like at a societal level, or we talk about cancer at a societal level as if it's one disease.
Yeah.
Like we use the term cancer to describe a cancer, but like not only is every cancer in a way its own disease, maybe the root cause, like runaway cell growth might be the root cause for a lot of them. It's not only its own disease depending on like where the cancer is or what part of the body it's affecting initially, it's also very like unique to the person who has it. Yeah. Like your testicular cancer and another person's testicular cancer is not necessarily the same thing, and it's not. And like from a genetic standpoint, it's not the same. So like we've talked about like CAR T cell therapy and like how that is like an emerging technique for treating certain types of cancer where you can and to treat it effectively, you have to like actually tailor a treatment that is like specific to like Taylor or Taaha or Brian.
Yeah. It's like being a water park mechanic, right? Like you can't just show up to a water park with one tool and fix all the rides. Yeah. Like there's water slides, there's lazy rivers, there's all these different types of water park themed rides. And if you had one wrench and you were like,
shit's not getting done.
Like I fix all the rides at the water park. Like it's just not going to work.
This bolt's bigger than the wrench that I have.
There's not one tool to fix all the water park rides.
Yeah.
What do you think of that?
He's really good at that stuff. He gave that Mr. Beast analogy in the other recording.
Yeah, he's
that
good,
one was really good. The Mr. Beast
wow.
one.
Yeah.
So
Thumbnails,
what about
but
this one?
This
Like,
one was not that. It was all right.
Subpar.
I'll give you your roses when you actually get them.
Okay, thank you.
So testicular cancer. Take us back to the diagnosis, the process of going through that. Obviously, you're a full grown man now with a beautiful beard and
Thank you.
and a big boy job.
Yeah.
But when you got your cancer, you were a little bit younger, a little bit less bearded.
Yeah.
So take us through that period of time. Especially mentally, like what was that experience like for you?
So I was writing midterms for grade 12 first semester, and I had like back pain all summer and didn't really think much of it. Went to a walk-in clinic. The doc, he prescribed me some like painkillers that seemed to do the trick to help with back pain, but I was like, there's this pain that keeps going on.
Really, in hindsight, just
Yes.
Do you-
6-inch tumor in my back. That's what it was.
Yeah.
So it extended the diagnosis, right? So I got this big lump in my stomach sticking out because the tumor's pushing up against everything above it, like my intestines.
Holy shit!
So
Whoa.
I'm in my
Wait,
bed.
sorry to cut you off there. The tumor is on your back.
It's in the retroperitoneum. So below.
No need to explain. He knows.
No, no, I really don't. Please don't.
So deeper than your intestines, and it's where your kidneys sit.
Okay, yeah. So like the spot, like the spot where if you get kicked, you'd be like, you're going down.
Yeah.
You're pissing.
So
Pissed. That's a Nick Cage. I'll put it in the YouTube. You'll
so
hear.
Then, where do we leave off?
So
the
you
tumor's there,
and it's pushing.
back pain.
It's pushing. It's so big that it's literally pushing your guts
up. Yeah. So I feel this big lump at like 2 a.m. at night, and I tell my
damn.
mom, like, dude, this is something's going on. I was having some abdominal pain too for a couple of days. I told my mom, I got to go to Emerge. We go to Emerge in my hometown, and then have an ultrasound the next morning, and like the doc comes in, pretty smart. He tells me, "Hey, son, go piss in this. Go pee in this cup for me down the hallway." So
That's how you.
Sup,
That's how
dog?
you,
know what?
Sup, dog? Go piss in this.
that's how you heard it. To be fair,
That's
You're
how I
like,
heard
all
it.
right,
No,
I
we
have-
talked to a doctor once who what's the type of doctor who works in your
urologist.
urologist. We talked to a urologist once, and he used the term asshole.
yeah.
So I'm just saying.
Sometimes
He was actually yelling at Taylor, and exclaiming what he thought of him.
Sometimes with teenage boys, you gotta break it down to their level. You gotta meet people
totally.
where they're at. I
Yeah.
think is really important. And
Go rock a
Where-
piss in this
Yeah.
jug here.
so, anyways, I leave the room.
Skibbity,
And
Ohio,
tells-
piss in this Ohio jug. He's
Tells
just
my-
skibbity.
He's just glazing you.
Write a whole LeBron song about it.
Sorry.
And I leave the room. He tells my mom, like, "Hey, we think this might be a type of cancer. We gotta send you downtown to kids' hospital because I'm 17." So I have no idea.
They don't tell you that. They say that
he
to
didn't
mom.
tell me.
Yeah. Okay.
Okay. I think I don't know why, but he told my mom. My mom held together until like a week later, where she was going through a lot.
Yeah.
I mean, understandably so.
Yeah.
So we go downtown, get a whole bunch of tests done, blood work done. Like I showed up to Emerge, and it was like 10 people at my bed, ready to like ultrasound, IVs, and everything, trying to figure out what's going on. It was like so busy at the top of the bed that at the like people around testing me that they put my bracelet on my ankle
No,
because
they couldn't
there's
get
just-
to
The
like
bracelet guy was just like, "Holy, can't get in
they
there."
can't get in. So, but anyways, we had a whole bunch of tests done, and the surgeon comes one night. I think 2 or 3 nights later, the urologist, and he comes up and he's like, "Hey, it's got some good news and some bad news." It's like 7 p.m. at night. I'm like, "Oh, I'm like, all right, I
Great
don't
way
know."
to start.
Yeah, great way to start. So, I'm like, he's like, "What do you want? What do you want first?" I'm like, "I don't know. Like, you tell me." Like, we'll start with the bad news and then we can follow up with the good news. I'm like, sure.
Because I can't really hide the bad news.
Yeah.
If I say the good news first, you'll know what the bad
The
news
good
Yeah.
news is we don't think you're gonna die.
Bad news, you got testicular cancer. Good news, the Leafs won last night.
Leafs won.
Up high. Hey.
Round 2. Who are they facing? Panthers, I think. Right?
That's correct.
Yeah.
We're recording this right now. The Leafs are facing
In
the
the second
Panthers,
round.
and by the time this comes out, the Leafs
They'll
have
be
won the cup.
eliminated?
And
Wow.
I hit my
Okay.
plus 1,500 bet that the Leafs were going to win the cup.
They're going to be on the golf course.
This is our year.
This is
So
So what was the bad news?
the bad news is like it looks like we got some type of cancer, and then he goes on to explain that it's testicular cancer, and like it's spread to your abdomen, and you got some spots in your lungs as well, and some blood clots in your lungs as well, and like this is like quite serious. Good news is if we follow the standard of care, and maybe add a little to it, we'll be able to have you cured. And then he goes on to explain about Lance Armstrong, how he was a public figure who had testicular cancer, and how his is cured, and now he's doing well.
And a fucking cheater.
How he's doing clinically well.
Right, Taylor? Right, Taylor?
I mean, yeah.
Taylor's a resident bicycle guy.
Oh
so
yeah.
he was a bicycle cheater, right?
He was a bicycle
I just
cheater.
want to ask again about like you brought up the word cured again, and like and it's interesting because they talk a lot about how a lot of people don't want to use the word cured because it like kind of brings about this sense of like guarantee that you're going to be fine going forward. And I mean, I feel different about it depending on how I think about it, because like, my mom had cancer almost 10 years ago now. She has been cancer free for about, 7 or 8 years. And so from my perspective, I like the idea of thinking that my mom is cured.
Yeah.
And, there's obviously no telling that like no guarantee that her cancer won't come back, but for all intents and purposes right now, she's cured to me.
Yeah.
But like they oftentimes don't want to use that word. And I say I mean like medical professionals or the system.
The man.
But you use that word. So like what are your thoughts and feelings?
For me personally, I threw it out because I guess that's what the vocab is, but like I personally don't like I haven't even rang the bell, which is like a huge thing in oncology, and like you ring the bell after you're done treatment and you're cancer free, your blood work all comes back good. Like I'm kind of superstitious about it, like personally, but it is a great feeling to see somebody else ring the bell, right? And see a friend or a colleague or somebody, a family member ring the bell, and so I feel like I've been on both sides.
Yeah,
but
that's interesting. That like when you see people ring the bell, you're like, oh,
really
that feels good. But like,
heart. Yeah.
but you don't want to.
I don't want to ring the bell. It's also, I think, the follow up too. Like I'm on a 10-year follow up.
Okay.
Some patients are on 5 years. Some patients are on a lifetime. Again, depending on the cancer diagnosis that they got. So I think depending on the cancer diagnosis they got and the likelihood of it returning as well is when they throw the word cure out. But I mean, that all doesn't really matter until like it's cellular biology.
What if the bell was shaped like those a pair of those like truck hitch nuts?
The truck hitch nuts.
Yeah, but it's just one nut.
Just one nut.
Yeah.
No. If they're golden, sure, but like I don't know.
One thing I want to
do that.
One thing I do want to. Well, actually, we went out and got you. No. One thing I do want to just throw back to. So he says you've got testicular cancer.
Yeah.
The tumor that was pushing like from your back to your front.
Yeah.
Is that the one that like is that a tumor that spread from the testicular cancer to a tumor in your abdomen?
Yeah.
Okay. So that was a result of the testicular cancer spreading.
Yeah.
And I thought that was, I can't say that word,
Yeah.
But I thought that was really bad. Like my understanding, like my layperson's understanding.
Yeah, like once it spreads,
you're dead.
If it spreads, you're dead.
Is that a term that people...
That's what my dad told me when I was in high school, and to keep me away from
about gonorrhea.
From sex. Yeah, he was like, "Hey, Jared, if it spreads, you're dead."
Yeah.
And I think he was talking about.
Oh God, dude!
Whoa, dude!
I'm gonna have coworkers listening to this.
You didn't say it.
You didn't say it. Yeah, Jared said.
Let's be clear.
Jared said. What's really funny is
no one's gonna actually know what I said because it's just gonna be a big old and for anybody listening, I said the worst possible thing you can imagine right now. That's exactly what I said.
And if you're watching on YouTube, just leave that in the comments. Let us see it.
Let us know. What's
leave it
the
up
worst
to their
word
imagination.
you know?
So as a young boy, and receiving the shit news sandwich. Do you remember like what went through your mind? Like
I was like, okay, like what does this mean for me, for my life? I'm 17. I haven't done anything. I haven't graduated high school. Like, what am I gonna do? Like, but personally for me, I really held it together for my parents because I knew that they were gonna be devastated anyways. But I was like, I don't want to make them cry anymore. But like, I think it's during treatment when you're kind of alone, sitting there in your bed, getting your therapy. You're like, all right, what does this mean like long term?
Mm-hmm.
But sometimes like you get caught up in your mind and you start going down rabbit holes.
Was there as a teenager?
Yeah.
Was there an added weight to that? Considering it was you're dealing with testicular cancer? 'Cause,
Yeah.
like.
Yeah,
You know,
it means
at
like
that age,
what
it's
does
like,
it
holy
mean
fuck,
for like having kids, right?
Yeah.
What does it mean for relationships? What does it mean for you're 17, you want to be a man,
Yeah,
right? Like
your sense of masculinity.
Yeah, exactly.
Yeah.
So like, what does it mean for all that? I fortunately had great friends around me that helped me kind of put those thoughts to the side, and we still did a whole bunch of shit. Like we went like bowling, not the most super masculine thing, but it was a fun night out.
Man, I think it's
Bowling's funner than
Bowling?
who do you think you are? I am. It doesn't get more manly than that.
But like we'd play basketball, and like we still like obviously within my limits, but I think having a great group of friends around me was important, and figuring out like, hey, listen, I just put one day ahead of the one day after another, right? Going in for treatment. Okay, these next 2 weeks, I'm crashing out on the couch every night because I'm too tired to do anything.
And for the Gen Alphas, that so when he says crashing out, he means getting tired and going to sleep, not losing his mind and going skibbity Ohio ape shit. You know?
yeah.
Crashing out a Gen Alpha term now?
Crashing out. Oh yeah.
Oh yeah.
Oh yeah.
You gotta be careful about what you say.
Yeah.
Because it's all code now. I had this moment.
Crashing out means like, oh fuck, buddy, crashed out. He's
Sometimes
crashing
I'm
out.
afraid of saying something that a different generation understands in a different way. And it's like, okay.
Yeah. Because the next thing you know, you're going to have a street named after you. In 25 years, that street is changing its name because you said crashing out.
Yeah. And at the time, you didn't really know what that meant.
No.
I want to ask too about the, like, when you talk about the burden of like trying to protect your parents' emotions while you're also going through the challenge of like dealing with your own mental health at that time.
Also, what a grown-up thing to think at 17, by the way.
Totally.
I wouldn't be thinking
but
like
it's like but it's such a common experience with people who are sick with like anything is like this feeling that it's like you actually have to take care of the other people around you that aren't sick.
I mean, we've heard a number of times how like it's oftentimes emotionally more challenging, or like the person who is sick is actually feeling like they're dealing with the emotional weight of their loved ones more than their own emotional well-being.
You feel like obviously all this attention comes to you all of a sudden, right? And you don't want to like burden, like I used to have my mom's friends like cooking all this food and bringing it over, and I was like, I feel like, I like the food, but like I felt bad like they're going out of their way cooking all this food for me. But you understand that it's coming from a sense of love, right? From a place of love. And for my parents, like I was just like, I don't want to put any more burden on. They got 2 other boys to look at, and like, you know, you obviously all their attention goes towards you, and you feel bad about, my brothers aren't getting any attention. My brothers aren't getting the love. But I think my brothers, both of them, understood really well about what's going on, what the situation was like, and I'm sure it was hard for them as well, like having to deal with all that stuff. My younger brother, I told you guys before, right? He still shits on me for like he had to do my laundry. He's like, "How you washed your underwear?" like he still gets at me for that. So, but they really, like, I guess, took a lot, picked up, stepped up to the plate and helped run the house.
Yeah.
I had this moment when my youngest daughter was born, and she had this like unexplained fever, like almost as soon as she was born, and so it was like pretty immediately in this like moment where you like haven't slept for a couple days and you feel like physically and like Kyla has just pushed out a baby and she's in this like massive recovery.
Yeah. And it was crazy because she was like, "It's okay, Dada." As like a
Kyla said that?
No.
Yeah, that's what Kyla calls Taylor.
Yeah. She speaks in that voice.
You're
too.
1 day old was like consoling you and trying to make sure that you felt okay.
No, it was that's right. Cause I was like, how do I make her? I just want to make her feel. She had this unexplained fever, and then there was all this shit, and then she had to go to the NICU, and like you have no idea what's going on, and they're running all these tests, and like in the moment of all that shit, I was like, it was like everything was like purely logistical. And I didn't like have much of an emotional reaction to like the whole thing. Cause I was like, oh, we just gotta we gotta go down to this thing and we gotta get the test done. And then we're gonna go back here. And then like, I gotta get food for Kyla and I gotta go do this. And like, I've got a daughter at home and like my grandparents are taking care of her and I gotta sort that shit out. And then after a couple of days, I had this like window where it was like, okay, I'm gonna go home and be with my older daughter, who I haven't seen now in like 3 days. And I got home and it was like just her and I put her to bed. And like all of a sudden it was this moment where I was like by myself for the first time in a few days. And I really haven't processed like anything.
Yeah.
Immediately went to Pornhub.
Opened up my computer, incognito tab. And I
You guys aren't holding back.
No, they never do. And I just had this moment where it was like, all of a sudden there was this like space for me to
there's this big release.
There was a space for me to actually like realize what was going on and like to process it. Yeah. And it was just like it was like such an intense emotional release where I was like,
because in that moment you can't like you to get by, you have to just like you said,
like
it's like every step, like just one step at a time. Because if you can sit there and take it all in the midst of it, that's when you start to lose strength, or maybe you start to lose, the drive or the will to actually like push through that kind of stuff. I mean, which I think
is
a
lot. Like, cancer diagnosis, but having a kid in the NICU, like that is so scary, right? This kid is just born and they're like 2 pounds,
and they can't do anything, and you're like, they can't tell you how they feel or what's going on. You're like, but I mean, all that to say is like, I mean, I think it ends up being, they're like both things are important, like being able to have the space to like feel what's going on.
Yeah.
But then also having the ability to be like, all right, I'm just going to like put that in a little box and I'm just going to put this over to the side for now because like I got to go to this appointment and I got to like figure out what the next steps are and I got to figure out my treatment plan and I got to like talk to my parents and I got to eat the food and I got to do all the stuff. And then it's like, and I'll take my moments to like reflect and realize like this is crazy and I'm going to go through this and like this means a lot for my life and what does it mean and how do I process that and figure that out? I think both of those things are important.
That's the thing that I find helpful about going to therapy is that like in there and you guys know that I talk about therapy a lot and talk about it as if it is the answer to a lot of these problems. And I don't entirely subscribe to that idea, but at the same time, like therapy is nice because you have these like check-ins and like I go to therapy like every 6 weeks. And so like in the instances where I find myself overwhelmed by my emotions and like sort of getting caught up in either being like too reactive to them or like shutting them down and trying to push them aside, by the time I get to therapy, it's like this point of like reflection where you can come back to like checking in on yourself. Yeah. And these like more acute traumatic events where you're like almost like forced into this like shutdown or some people like reactive state. Yeah. It's nice to be able to like have that sort of step back out and like evaluate it.
Yeah. Like I agree with you. And having someone there that you trust to be able to kind of bring you back to the center point, right? Like, but at 17, you got no sense of that. Yeah. Like you have no idea. You don't fully understand, or at least I didn't fully understand what mental health is all about and how that plays an important role in not only like your treatment, but your willingness to go day to day with life.
I want to get into the advocacy work that you do, but before we do, just to kind of like put a bow on this, and to that point, I am curious, like after you go through treatment, after you you walk out the door and you think to yourself, okay, I got through that, and fingers crossed it stays this way now until I'm old man and I'm dead.
Yeah.
How at that age, and I'm sure it's not like it happens within a span of a year. It's probably something you're still working on to this day to some degree. But like, what was at least in the early stages, like, how did you put your life back together? How did you kind of pick up the pieces after all the dust had settled?
Oh, Mr. Cook. He helped me a lot. So
is that your imaginary friend?
That's my imaginary friend. No.
Is he here right now? Can we get him on camera?
Him and Justin, right? Those two guys that we just No, but so when I went back to high school to finish up grade 12, he was like the guidance counselor.
Yeah.
And this guy like carried me through. Like he helped me kind of get my shit together, for lack of a better term, but helped me figure out how to just navigate through high school, apply to university, set goals for myself. And like you mentioned, therapy, like he was my like therapist every couple weeks, sometimes twice a week. I'd go in and just kind of talk to him about whatever and whatever's on my mind. And he was just like such a great listener. I think that's one of the big things I learned from him. And someone else, a social worker, that listening is such, you don't even need to say anything sometimes, but just listening and let people just kind of vent almost is such a huge thing. But yeah, getting back to like getting my life together, he played a huge role. My brothers, again, my friend, Reddit played a huge role too.
Oh yeah.
Like those communities on Reddit in the testicular cancer community or the cancer community on Reddit.
You mean like being like were you trolling people and like getting your anger out by just like
no,
that's fortunate.
But hearing other people's stories, I think was what it was. And then you want to kind of move past the screen and start actually being able to hear other people's stories. So I saw this not a boxing commercial, but the Canadian Cancer Society had a commercial where this guy was like sitting on the edge of a bed, and it was like they played the boxing ring, like the bell rings, and like he's sitting there to fight cancer, right? That was their old slogan. And I was like, oh, let's see what these guys are all about. And they had I was in the toilet, like on the toilet, and they had like the paper towel, not the paper towel, the toilet paper was like sponsored, or I don't know, Royale was doing something for the Canadian Cancer Society. So it was like two signs that,
oh yeah, okay,
like, all right, these guys are for real.
What? They're sponsoring toilet paper?
You were wiping your ass with the Canadian Cancer Society. I mean, that's not super great.
I think, but you know what? Like you started to see the Canadian Cancer Society. As a patient, I'd see like, bits and pieces about this organization. Then I was like, okay, what are they about? And I knew that they were already helping me. And helping like people with cancer all over the place. But what can I do to help support this organization? And I'm in grade 12, finishing. I had all my like high school hours. In Ontario, you need 40 hours to graduate high school. But I already had my hours. But I was like, I need to do something else in my life as well. Not just go to school and come back and play NBA 2K. Let's find a better.
As great as that is.
As great as it is, yeah. But so I got involved with the local office. I just applied online and got a phone call the next couple of days later about, hey, like, how would you like to get involved? Told them my story and told them what I do or what I want to do with my life. And they have this youth troupe, which is huge now. We were talking earlier about this like national group of students across Canada that all meet monthly and plan out initiatives, and then they go to their communities or in their high schools and do community projects. So that all started in this small library in person with like 6 or 7 students in high school. And we would meet with a volunteer who would then talk us through plans that we can kind of work out, and we would go out, do some advocacy work with like locally, municipally, and then provincially as well with the Minister of Health of Ontario back then in 2019.
Was it, were the other volunteers mostly people who had cancer, or?
There were students who were passionate.
Okay.
Really. I don't think any of them had cancer, or I didn't know of any of them that had cancer, but They were passionate students, and some of them are doing all of them are doing great right now. Like they're 24 now, 25, and they're all like that. I think that was a cornerstone of their development as people as well.
Yeah. I could see how like when you're 17 or 18 and you have I wasn't thinking about volunteering for big organizations like that, and so like students who are taking that sort of initiative at that age, and wanting to make the world a better place, like you can kind of see the path that those people are going to end up being successful people down the road. What was your experience like getting involved with the Canadian Cancer Society and like did it change like how you thought about your diagnosis and what you wanted to do with your life?
I think it helped me so we would have advocacy like almost like a strat plan, right? Like this group of like 10 people in a library coming up with a strat plan and figuring out how we want to advocate. So one of the big issues was vaping, which we can talk about later, and that was an issue that we would see firsthand in school, right? And then figuring out how to advocate for policy changes about it, to hope, and public awareness as well, and especially directly to students, and what we can do to reduce those numbers. But that kind of helped me put into perspective that like the advocacy part is so instrumental in anything in healthcare. You want a new drug passed through, or you want a new treatment, you need funding for a hospital or a unit, you need funding for staff to work the hospitals, right? Like all of that stuff goes through in our public healthcare system, it goes through government, and how you can advocate for better patient care through all those different means. For my own diagnosis, I started to look back at because testicular cancer is quite, I don't want to throw the cure. I don't want to throw the cure word again, but it's easier to treat. It's still a rough treatment, but it's the treatment's there. Like we have a pretty good standard of care. Then I started to go back and look at the history of testicular cancer and cisplatin, that drug. How did that change the world? And then I actually emailed the doc, Dr. Lawrence Einhorn out of Indiana, shot him a cold email like, hey, thanks for everything you've done with your life. And, just so you saved my life. I'm out in Toronto.
Did he develop the drug?
So the drug got shelved, and he had a patient, I might be wrong, it got shelved, but he had a patient that had minimal hope of being treated. And he pulled that off the shelf and gave it to him through a trial, and that patient survived.
Oh, and then they were like, okay,
this might be something. So, but just fact check that. I think
no, you said it. It's true. I'm sure it's true. We'll take it as gospel.
It's a good story.
Yeah.
And everybody, and if you can get if anybody out there can get it on the black market and just start giving it, you can just take it. You can just take it.
Yeah. And his name was Dr. Cisplatin.
Dr. Cisplatin.
Yeah.
That's a cool name.
This is going to be the 2025 Vermectin. Ivermectin. This is going to be 2025's ivermectin.
How did your involvement in advocacy play any role in your decision to become a nurse?
I was pretty set.
Was it more like I'm gonna go with the ladies?
I'm gonna go with the ladies.
Yeah.
Wow, really playing on
so
some
the Airbnb
stereotypes
we were
there,
staying
Jared.
at last night had a bunch of ladybugs, and we kept joking. We're afraid of the bugs, we're afraid of the ladies, not the bugs. But I think I was pretty set on being wanting to become a nurse.
Yeah. And where, why? Like, where did that come from?
I had great nurses, like really great nurses that took care of me, and I was like, wow, these people do great work. Not that like social work or the physicians or the surgeons or the PTs don't. They do great work as well, but I just really liked you get to know your patients really well.
They're so with hands-on. Like a good nurse,
like 12 hours.
Yeah,
right?
There's nothing like it. And it really does make or break a stay.
Yeah.
Like being admitted to the hospital, I've had my fair share of nurses that were unbelievable.
Yeah.
And I've also had my fair share of nurses that sucked.
Yeah. Yeah.
And the ones that are just absolutely incredible, stick out. They will stay with me for the rest of my life.
Yeah.
As will the ones that were the worst,
horrendous.
And it's like,
because you can have a good
all the
nurse.
ones in the middle, I don't know. Like they just yeah. But the ones that killed it, like I still to this day think about. There's one particular nurse that I think about to this day who I'm just like, she meant so much to me in that that short period of time that I had to.
Sometimes they just say the right thing.
What was it? What was it that like? Was it? Yeah. What was the thing that she did differently?
It was. I guess it was like a sense. So
the reason why you become friends with people, like because you connect with them.
Here's what it was: is she treated me like I was a friend, right? Mm-hmm. Without crossing that boundary. So it's like I know she wasn't my friend. She was my caregiver. Mm-hmm. She was my caretaker. Like she had a job to do. But when she was there doing that job, I felt like
hanging out with the bros.
Yeah, I felt like we could be friends.
Yeah,
and it was that type of communication, that type of like giving time and not feeling like she's just doing the rounds and has got to get to the next thing.
Yeah,
it's like she was present with me, not the number that was on the chart. Mm-hmm. And not to say that all the nurses weren't like that. It was just, and maybe it was also just like
you caught her at
some sort of connection that we just like
you're
had.
Just compatible with each other.
Like exactly. Like there was a compatibility there, but also she was just a great nurse. Like she did.
And a
her
good
job
nurse can
really
get you
well.
like a good nurse. You can get a doctor that comes in and is like has horrible bedside manner, delivers news in a shitty way because they're like, I got 30 seconds to be in here and then I'm going and then I'm leaving. And like the nurse can be with you and the nurse can be like, okay, like let me like filter.
Explain.
Now that jackhole
like,
on.
he didn't really say that in the way that he maybe should have. So like let me kind of like filter that information.
I think it's a part of the way the system's set up too, right? I'm sure physicians, if they had time, would sit down for much longer, right?
Some of them, some of them,
yeah. And but like you said, there's good and bad in every profession, and like nurses, I think being present. That's what I try to do, really be present, and like sometimes like you're treating the disease, you're there, but like sometimes you forget the disease that they have, right? Like you're hanging out with little Bobby
Timmy.
or whatever, little Timmy, right? Like. So is that
that's such a stereotypical little kid, little Timmy
Turner, right? So hanging out with them, sometimes like if I have enough time, I'll play the kids in 2K.
Hell yeah.
Yeah.
That's actually
show them
sick.
up.
Do you just like destroy them?
Yeah. No mercy, dude.
Do you play the way I play against my nephews in WWE?
Yeah, we're not handing out participation trophies here, dude.
Well, I think it's the way I really liked it when the nurses treated me like they didn't give me this whole fake empathy bullshit thing.
Mm-hmm.
Like they treated me like, yes, I have cancer, but they also treated me like a human, like a 17-year-old teenage boy, 18-year-old, and would talk to me about stuff. Like that.
Yeah.
I felt like that was where, like you mentioned, that connection came from. And that's what I tried to do with my patients, like treat them as a person first.
Yeah.
The diagnosis comes after.
Because like that's what they are. Like they're like person first. Like because you can tell when somebody's treating you like you are the thing that you've got.
Yeah.
And that's not what you are.
But also it's like such a win-win for the nurse to engage with a patient on something they're interested in. I mean, imagine being like, and you can obviously imagine this, you live it. Like when you're on a 12-hour shift and you're thinking about charts and all these things you have to do, what a breath of fresh air to be able to go in and connect with a human being on something they're interested in, or like find out more about them. It's like it must help break up the day a little bit.
Oh yeah, no, it helps a lot, and it's refreshing, right? Like it's like you go in and you're talking about the NBA playoffs.
Yeah,
it's like like none of my other colleagues watch basketball, but I got somebody in room whatever down the hall that loves LeBron James. All right, let's go. Right? Like it's great.
Funny
and then you got someone next door who hates basketball, but they can't go anywhere. So you kind of just like you just give them a good old ear beating.
Yeah,
latest game.
I've learned like a lot, like a lot of what's that dog show? Paw Patrol.
Yeah. Paw Patrol?
Paw Patrol.
Oh, man.
Who's your favorite? Oh, you probably
I've been through the Paw Patrol ringer. I'm on the other side of it now.
Okay.
I'd say I'm a marshal.
Marshal, the
I'm a marshal guy.
firefighter.
You know,
right?
I've never said this on the show before, but I always thought Paw Patrol was Papa Troll, like
Troll.
like Papa, like troll, like
the trolls.
The troll is a Papa.
Okay.
Like Papa Troll. And so I would hear Paw Patrol all the time, and I was like, in my mind, I was like, I figured it out. Like I saw show.
something,
Yeah,
yeah.
Papa Troll is walking around taking care of all his little baby trolls. And then I saw the show and I was like, what the whoa, what the this is the show glorifying police violence with dogs? Oh my God, guys.
Do you ever come across, is anybody watching Bluey? Because
Bluey's huge.
Awesome.
Miss Rachel is huge.
Rachel makes
Coco Melon
shoot
is
myself,
like
but
crack. Oh my
Coco
God.
Melon should be illegal.
I think so too. Yeah.
Yeah.
Coco Melon is
We actually we played with the idea
Sounds
of
like
doing
stripper names, all of that.
we played with the idea of doing
Miss Rachel, Bluey,
legit doing a Sick Boy Kid show. And I think, guys,
Miss Rachel, Bluey, Coco Melon. Couldn't believe it.
if you guys think that we should do a Sick Boy Kid show, let us know.
Oh my God.
Let us know.
Kid
because
show. What would that be like?
it would be making conversations about
Kafsuka?
illness accessible to kids.
Okay.
You know, like
Yeah. Through inappropriate humor.
Okay. I'm sure that would.
Inappropriate
would work
humor
with-
as the vehicle. Yeah.
yeah.
We'll get there.
Hey man, I had my own kid show for a little while.
You
Well,
did.
we have like that's a huge thing though. Like being able to teach kids that are 2-3 years old why they need a tube sticking out of their chest for 6 months.
Yeah.
Right. Like
Yeah.
the child life specialists, they do a lot of that work.
As much as I hate Miss Rachel, there are things where it's like videos where they're like, hey, I'm at the doctor clinic today.
Yeah.
And they like make a fun thing of it so
Yeah.
that like the kid who like hasn't been exposed to like
The doctor clinic.
a brutal hospital experience yet
Yeah.
is like their idea in their head when they go to the doctor is that it's like, oh, it's kind of like a fun
Just
kind of
another-
spot.
like
And
a
like
school
this,
trip,
like,
like a
Rachel's
and like,
clinic.
oh, they're gonna
Yeah.
like poke me with the thing, and like that's okay, and like,
Yeah.
and so there's parts of me when I'm watching things like that
Sounds
that
like
I'm
you're
like,
setting them up for failure. Oh yay! You get to go to. It's like my dog. I'm like, oh, there's treats at the vet. There's treats. We get to the vet and they're like, all right, time to pull your teeth out and cut out your balls and then send you home. You know, like, and he's like, don't ever take me back there again.
the streets.
I before we come up to time here, I want to, so again, you've been through the ringer. You took that and basically allowed that to propel your life forward in this direction where you are helping people who've been through something similar to what you've been through, not just in your professional career, but also in your free time working as an advocate with the Canadian Cancer Society. As someone who is on that side with the society, what like right now, like what are the sort of the things that you look at as a need or like a really deep-seated need for change in the system, or like awareness and education? Like what parts of the advocacy are really kind of turning you on right now?
I think what's turning me on is
I was gonna make a joke
Outside of
about
Bluey.
friend.
I think the big thing is there's a few. Firstly is like the cost of cancer care. I think as Canadians, we have this perception that we've got public health care, everything's covered, when truly it's not, right?
Totally.
Like it's not covered. It does cover a good chunk of it, but I think the stat is like $33,000 to $35,000 out of pocket cost for cancer care is what people pay
On
Yeah.
average,
on
across-
average
across
across
Canada.
Canada.
Just to highlight that really quick too, like my mom, who, as I mentioned earlier, has survived cancer, now has $500 a month in expenses and catheters
Yeah.
to be able to go to the bathroom. Like
Yeah.
without those, my mom will die.
Yeah.
And it's $500 a month, and like that's a massive expense for
Brian,
her.
you know
And
what it
it's fucking
reminds me
crazy.
of? The conversation we were having last week with Sean about the QE2, about winning the QE2 home lottery.
Yeah.
So you win the QE2 home lottery, this
Okay.
big lottery thing where they give away a house.
Uh-huh.
And like, let's say you're somebody who's like, I make 40 grand a year.
What
And
the-
you win the QE2 home lottery. You get like a $1.5 million home
Yeah.
that they give you. The home,
Which here in Halifax right now is a trailer down by the by the swamp.
the home is paid for, but the QE2 lottery isn't covering your property taxes. They're not
Yeah.
covering your electricity bill for this $1.5 million
Yeah,
home.
that's a good
They're not
way
covering
to-
this.
to look
And it's
at
like
it,
you're
yeah.
like, oh sweet, I won this big home, which I could have
Yeah.
never afforded.
Forward.
Except with
Yeah.
cancer, you didn't win
With
just
cancer,
have
you
the
didn't win anything.
expenses.
But what I mean is like, yes, you have this like massive cost that's covered, which is like going to the hospital, staying in the hospital, the care, like the
lump sum,
the crazy
Yeah.
treatment. But it's like all the peripheral shit is enormous.
You're still in a deep hole after too, right? Like in Ottawa, I spoke with some people, and like we've all heard the stories of people in the States, you know, putting their house up for sale, getting rid of their savings, digging into those same stories here in Canada. Like people from we're in Nova Scotia, New Brunswick, who have had to like savings are gone, right?
Yeah.
And if you're like a 20, 30-year-old, you can't even remember, like, how are you supposed to start
do you
your
even
retirement-
have savings
your
at that
pension?
point?
You can't do
Yeah.
anything,
Yeah.
right? So that's a huge cost.
Not to mention
And-
if you want to get in be part of trials and, you know, like in the cases where things aren't looking good for you and you need to like go out, some people have to go down to the States and do things like one of our good friends, Brandon, who died from his cancer, traveled to the States a couple of times to be part of these trials that, you know, would have cost his family tens of thousands of dollars to be part of. And, you know, like that's not covered as part of a just disease that you know, like you just got. Like it's the luck, like quote unquote luck of the draw.
I think like that's we spoke earlier about how cancer being all these different types of cancers and everyone's got their own experience, but that's like the one thing I think that ties everyone together is how much it just destroys your life and not only like financially, but then fragments your family, right? If you're with your kid at the hospital, or if you're with your mom at the hospital and they can't work, you can't work because you're taking them to and from the hospital. You've lost like two sources of income there. And how do you figure life out, right? That's a huge thing. And it takes years. Like for us, it took years to dig out. And if that's, you know, and if you've just emigrated to Canada, now you got to figure out the system. The system is so messy, and navigating the system. Luckily, we have like, I guess the bigger centers have navigators for patients. I don't know. I wouldn't be surprised if the smaller centers don't, but navigating the system, learning a new language, learning like this whole, you come to this country to hopefully live a better life, and you're dealing with a cancer diagnosis. That's a huge thing that I think is really important. It almost gets overlooked.
And this is just, you know, just one small sliver of an example of the type of stuff that the Canadian Cancer Society is like working towards finding a better future for patients. And again, like that's just one. This is, it's such a broad spectrum, and we're so grateful for everything that you guys are doing, and just think it's absolutely incredible. And to be a part of that volunteer summit that you guys invited us out to in Ottawa was it was just beautiful to see and meet so many people like yourself that are doing such like important, valuable work. What's one thing that you would say, the biggest thing that you would say cancer has taken away from you?
Oh, you asked me this last time. I don't remember what I said then, but
clearly it didn't matter then.
Took away my teenage years. Part of me almost like, you know, it is what it is. It's a card or the hand that I was dealt. But like I fell behind, you know, sort of say in school, and it took away like all my teenage years. With that being said, like being behind, it almost kind of lit this fire under me to kind of like you want to catch up. And I think everyone after cancer treatment, almost everyone has that feeling where like you finish treatment and you've fallen behind and you're like, you know what, I got to crank it up a notch and I'm going to like catch back up. I'm going to get my life together, which I think is great motivation, but you can easily burn out from that. So then I had that fire and then that burnt me out. And then I realized, okay, I need to take it slow, 1 day at a time, 1 week at a time, you know, and then eventually one semester at a time, and get back to life that way. So yeah, taking away those prime teenage years. But
what would you say is the biggest thing that it's given you?
Oh, last time I said a Sickboy's podcast, but I think for me the biggest thing is perspective is. Like life is so fragile, like so fragile. like there's so much that can go wrong in life, and yeah, being diagnosed with cancer sucks, and I could have died, yes, but being appreciative of all the people around me who helped me during that, and even if I did die, like being appreciative of them still, and knowing that it's only right to share that kindness and love with others, to the best of your abilities, I think is really important.
Yeah, man. The annoying thing about this conversation is that we could probably talk for like
A couple
3
more
or 4
hours,
more
yeah.
hours.
Yeah.
And there's so much to your story of your experience with cancer and all the work that you do. But honestly, dude, like, thank you so much for coming in. And
Thank
doing
you
this here.
guys. You guys, I brought you those hero chocolates because I truly think. I watched a couple of your episodes. The CAR T one I think is really great with Dr. Kaufman.
Yeah,
That's really great. The one with Dylan Buskermullen,
Yeah.
is a great one too. And then the what is it? The not telekinesis, but
the
telepathy.
telepathy.
Well,
That one's good too.
Yeah.
You guys are just shedding light on all these super important having conversations about things that people don't often have conversations about, even within healthcare, right? Like everyone, sometimes as you come to work, you do your shit, you get exhausted at the end of the day, you go home, but having deep, meaningful conversations about what goes on in the lives of patients outside of the hospital and years down the road is really important too.
Mm-hmm.
Well, thank you, dude. I mean, we're grateful that you have contributed to those conversations, and that we were able to capture this and actually be able to keep it as opposed to just have it
hopefully
fall down the
I
ship.
joked too because the photographer that day, he lost all his footage.
Oh no!
And then I went.
No.
He comes up to me. He's like, "Oh, we lost the footage from you. We got to do another interview." I'm like, "Sure." I'm like, "I hope those guys didn't lose their footage." And then I go to the back. Like literally 30 seconds later, Dylan's like, "Oh, did you hear?" I'm like, "No, what happened?" He's like, "They lost their footage." I'm like, "What?"
Well, you drove out here, and we got it back, and we're so glad.
Honestly,
so glad to have it.
Way better.
Yeah, this is great.
This
This
is
is great.
awesome.
No suit, no nothing, man. Like I hate wearing suits. I hate wearing scrubs.
Yeah.
I
feel you.
Just wear like
They're
whatever.
costumes.
Scrubs.
They're
yeah.
work costumes.
Yeah.
I don't like
Yeah.
scrubs, man. It's too like as a. I don't know how much longer we can go, but as a patient, like at least for me personally, I know there's some patients that see somebody in scrubs and they think, oh, this is somebody that I can trust. They're in uniform. But at the same time, as a kid, like when you're diagnosed with cancer, like, it just feel institutionalized, right? It's like, no, let me see somebody who's cool.
Yeah. Maybe it depends on the kid, though. I could see a kid seeing a set of scrubs going,
Oh my god! Well, they get conditioned to it, right? They see the yellow. We wear a what's.
I was going more for the.
All right, see ya. Yeah.
I was going more for the horny for a nurse turned on kind of scrubs. Look, you know?
That's one thing.
The Halloween costume.
Yeah. Now that's all I can picture is you in a
Me in a Halloween costume.
you in a little white and red ditty. Okay,
All right.
well, I'll cut that out. Taaha, thanks, dude.
No
you're,
problem.
You're an absolute gem, and we're so glad to know you, and so glad that you were able to have this conversation with us. So
I
thanks.
appreciate that too, guys. Oh, he left, huh? Okay, but it's all good.
Now that Taylor's gone,
Now that he's gone.
yeah.
All right, that was great.